everyone, Amber Canoy here with Everyday Kentucky for our journey around the Bluegrass with DG Gridley of Aging with Grace. And you've brought us over into Nicholasville at Bluegrass Hearing Clinic. Why did you bring us here?
Well, Amber, we're here at Bluegrass Hearing in Nicholasville because we're going to talk with Dr. Vanessa Ewert about hearing loss in seniors.
We are back over at Bluegrass Hearing with Dr. Vanessa Ewert talking about depression and anxiety and how that relates to hearing loss. So I'm really interested to learn a little bit about this.
So we see an increase in depression and anxiety when people have untreated hearing loss. Because what we tend to do when we're not hearing people is we just don't engage. So it starts to turn into, the extreme, like a social isolation situation. What we hear a lot from our patients is, I stopped going out to eat with my friends. I stopped going to family gatherings, or I'm kind of like off to the side, sitting by myself in those situations because I'm just not enjoying them. I'm not hearing them anymore.
And isn't that the environment in which hearing is usually the most?
Yeah. Absolutely, that's the biggest complaint that we hear from our patients.
They can't hear in a restaurant. They can't hear.
Yep. When there's a lot of background noise that they can't hear in those situations. It's the hardest. I mean, if you think about it, with normal hearing, that's the hardest listening environment for us as well. Add some hearing loss on top of it, it almost makes it impossible. So you're just not engaging. You're not interacting with other people.
We're social creatures. We need that interaction to be healthy.
So it just makes sense that we see that. I mean, it amazes me every time someone comes into my office before they're fit with hearing aids and we're doing the test and we're talking about all of their hearing goals. Like, where do you want to hear better? Because that's how we make our recommendations. It's really lifestyle based. And then they come in, they're fit, they're very quiet, they're very meek, and then they come back for that follow-up a few weeks later. They're smiling, they're talking, they're super chatty. It's a totally different person. I mean, it's amazing how much just being able to interact with the people in your world and your life can truly change that quality of life for you.
Yeah, and going into more the anxiety aspect of it, we've talked so much about the balance, the falls. So like if you're not getting your hearing tested and you have hearing loss.
Oh, you're right, Amber.
You know what I mean? Like you almost become really anxious of like, when am I going to have my next fall?
Fear.
Fear kind of takes over.
Yeah, well, you're afraid of like going to a store alone because you're not going to hear the clerk right or something like that. You're afraid of doing things alone. Going to even a doctor's appointment, which is a quiet listening environment, but they'll take someone with them because they're afraid they're not going to hear, something really important. And those types of things, that causes a lot of stress on someone. Just being afraid, like, am I going to hear that right? Did I hear that right? I'm not really sure, and it can be disorienting and all those things. So it's very scary for people.
Yeah, and it can be embarrassing, which leads to the anxiety even more, right?
Vicious cycle, yes.
Yeah, all right. Well, if they have questions, if they need to get a hearing test.
Yes. How can they do that? They can just give us a call, or they can just find us online at bluegrasshearing.com.